Hi guys, so for today's video, I'm going to demonstrate the lateral view of paranasal sinuses or the lateral projection of paranasal sinuses. It's either left or right lateral. Okay. Ask the patient to remove all metal, plastics, and removable objects from the head, just like necklace, earrings, and shades if there is any. Place the patient in an erect position and then place the lateral aspect of the head against the IR. It's either right side of the patient or the left side of the patient, just like this. The side of the interest should be closest to the IR, which is the left side of the patient. And then adjust the head of the patient in a true lateral position and then move the body of the patient in an oblique direction for the patient to be comfortable. Just like this. The MCP or the mid-sagittal plane should be parallel to the IR, and then adjust the chin so that the IOML should be perpendicular to the edge of the IR. Center the central ray to a point between the outer canthus and the EAM of a patient. The reference point is here. So next is the technical factors of the lateral projection of the paranasal sinuses. So first is the collimation. When collimating, you should include the frontal sinus and the chin of the patient and the anterior part of the patient to include skin margins and the posterior to include EAM. Next is the IR orientation is in landscape or lengthwise. The IR size should be 8 by 10 inches. SID is 40 inches. KBP is 70 to 80. MAS is 20 to 25. And respiration is suspended in this projection. Shielding. You should put shielding outside the region of interest to protect the patient, and it's for its safety. Okay, structure shown of this projection, it will demonstrate the four paranasal sinuses, which are the frontal, ethmoid, sphenoid, and the maxillary sinuses. So the clinical indication is this projection is helpful in assessing inflammatory fractures or process to facial bones, orbits, and paranasal sinuses. It is also important view for localizing foreign bodies in trauma setting and inflammatory conditions such as sinusitis, secondary osteomyelitis, and sinus polyps or cysts.